For women diagnosed with breast cancer, there's an encouraging trend. Mortality rates are going down, but not for everybody. Black women have a 40% higher risk than white women of dying of breast cancer. As Stephanie Lydon reports, there's an effort in Boston to close that gap.
Tracy Battaglia had just finished her junior year in college when two things happened that would profoundly impact her life. She earned an early acceptance to medical school, and she was diagnosed with cancer.
When I faced cancer, cancer was my #1 priority. It was the worst thing in my life that I was dealing with.
She's come to see the way she dealt with her own cancer as a kind of privilege, one she says many of her patients, often women of color, can't afford.
Breast cancer is not necessarily the worst thing in their life. They're challenged with making decisions day to day about going to work so they get a paycheck so they can put food on their table. And when you're going through chemotherapy or radiation therapy and you need to be there every day, sometimes you have to make hard decisions.
Income and language barriers also put women at an increased risk of missing treatments. For Charmaine Bramont, it was finding a way to the hospital.
After the mastectomy, I went into chemo.
She went through months of treatment at Boston Medical Center. It's only a few miles from her Mattapan apartment, but getting there was a conundrum. Public transit wasn't an option because of the side effects of her treatment, nausea and a compromised immune system. Family worked, so Bramont took a taxi, a luxury possible only because the hospital picked up the tab.
Without the hospital helping you figure out transportation, is there a chance you might have missed appointments?
That's a possibility.
Bramont benefited from a patient navigator, a person who works at the hospital and helps patients get there.
Hi, Jenny.
Hi, Jenny.
Navigators do things as simple as providing cab vouchers and as complex as helping a patient find stable housing. Dr. Battaglia says patient navigators are a proven way to make sure at-risk patients get treatment. But many patients switch hospitals during their care, and navigators lose track of them.
We don't have a safety net in the city to put our arms around that population of patients to make sure that they're getting the care they need, even if it's not at our institution.
Now that could change. The city's major hospitals, normally competitors, are launching a 5-year test of cooperation. Patient navigators will work together to create a citywide registry. It's designed to track and offer help to hundreds of women at risk of missing breast cancer treatments.
If we can demonstrate the ability to do this in breast cancer care, the sky's the limit for disseminating this model outside of Boston to other cities.
The goal, to give everyone the same shot at survival. Stephanie Lydon, WGBH News.
If this model works, researchers say it could also be adopted to treat other conditions from diabetes to heart disease in which race and income influence outcome.